Okay, good afternoon, all. It's a pleasure to have you here with us as we get to the last third of our seminar series. Today's speaker is going to be Gigi Gronvall, who is going to be introduced by Francis de Cleva momentarily. I want to say a couple words about the seminar today and how it's going to be run, and I'm going to say a couple words about current events, but not dwell on that. So, when we named this seminar something about advice for the next administration, we didn't know who the next administration was going to be. And we just did that in a kind of I think, playful way, but also to indicate that, maybe the administration, whoever it would be, would need some help. So, we trust that you're all like us, absorbing the news and, coming to grips with it and thinking about how we're going to move forward. We empathize with you, and you're welcome to talk to Dr. Furberman or me anytime if you have things you want to bring up or, feel like you want to discuss in private or you're having a tough time of it. But Adrian, you want to say a couple words?
Yeah, I just wanted to say that it's really important to keep fighting for what you believe in, and that's the only thing that's going to make a difference. And we just need to work together on making things better. And also at 1:30, some of us in the farm department are getting together just to talk about the election results and vent. So if anybody wants to join us, we'll be in Northeast 403.
Okay, and I want to mention that I sent out a table related to Native American health to the class. If anybody who is in attendance wants to see the table that Dr. McCool mentioned last week, shoot me an email. I can send it to you as well. He appended his thought about the election last night, which was, I guess, quoting Mama Cass or somebody like that, or whoever she was quoting, the darkest hour is just before dawn. So let's hope she was right. So with that, the seminar is going to be about 45 minutes long. I told the speaker today that she's welcome to run it any way she wants. She's not going to use slides. She may pause here or there to see if you have questions or comments or stimulate discussion. She's going to go for about 40 minutes. And as usual, the question and answer period at the end is going to be first student questions and then anybody else. I'm expecting that Jennifer is going to put in a link to our program. I don't want to take additional time this morning at the beginning to get into a spiel about what the HAPI, their Health in the Public Interest Program is. It's basically a one-year MS in non-medical or social determinants of health, and you're welcome to look at our website and learn more about it. So with that, Francis.
Hello, I have the pleasure of introducing Dr. Gronvall. Dr. Gronvall is a senior scholar at the Johns Hopkins Center for Health Security and a professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. She's an immunologist by training. During the COVID-19 pandemic, she led the center's ongoing efforts to track the development and marketing of molecular antigen tests and serology tests, as well as the development of national strategies for COVID-19 serology tests and the COVID serosurveys in the United States. She leads work on improving indoor air quality to reduce pathogen transmission, including guidance for the K-12 schools, and is a public health advisor to the Baltimore City Public School system. She has also written about the scientific response to the COVID-19 pandemic, the contested origin of SARS-CoV, and the implications of the national and international security. In addition, a fun fact about Dr. Gronvall is that she's a member of the Marching Ravens. She plays the baritone for the official marching band of the Baltimore Ravens football team. So without further ado, you can take it away.
Thank you so much for that introduction. Can everybody hear me okay? So, well, first of all, thank you very much for inviting me to your class, and I love that it is open to a broader audience. That's very cool that you have it arranged that way. And so, so thank you for inviting me in. So this was scheduled some months ago, as was mentioned, and but as it grew closer, and I started writing down some thoughts about what to talk about today, I was feeling a lot of dread, which turned out to be quite deservedly placed. Thinking not really so much about 2020, but about 2016, and when I was scheduled to give a talk the day after election results came in. It was in Geneva at the Biological Weapons Convention, and that's the treaty that prohibits any nation from developing biological weapons, and it's been in force since 1975. So it's an old treaty, but they have meetings every year, and so I was at that. I was in Geneva when the news came that Trump won the election in 2016, and got to see the various reactions of the super professional State Department staff. Really just they were amazing. The cackling and happiness of the Russian diplomats will be forever seared in my mind. But anyway, but at the talk that I was giving was about, what should be the health security priorities for the convention, but, also for the US, and what sorts of priorities there should be. And I knew very well what Hillary Clinton's priorities were going to be for health security, because she had been long involved in this topic, and she had attended meetings we had put together when she was a senator and things like that. So I knew quite well how she thought about things, but did not, it was hard to speculate what the next administration would be. I also served at that time on a Department of Defense advisory committee called the Threat Reduction Advisory Committee, and that was disbanded pretty soon after the Trump took office, because all of the advisory committees were disbanded during that time. So could be something that will happen. But there were some things that did happen over the course of that administration that did give us some hints about what their priorities may be, and maybe how those can be shaped in the years ahead. They did put together a biodefense strategy that was the first time such a strategy was developed, and so that dovetailed with the national security strategy that is always put forward by administrations. There was a recognition that basically that China was eating our lunch on a technology front, and we needed to do more to boost biomanufacturing in the US. And in fact, the one time I did go to the White House during that administration was December 2019 for a summit on biomanufacturing and how to boost the bioeconomy. And happy to talk about what the bioeconomy is, but there's a lot of things that we currently make using petroleum that can be made through biological processes. And so there's also when you make the environment, but it's also more flexible. You can make things in more places, and have more distributed manufacturing, which has advantages as well. So they called a meeting about that, and so there was a lot of interest in that topic. Of course, we were all in these rooms, and they said, how can we get young people interested in going into helping the bioeconomy? And we were all kind of looking at each other and saying, climate change, but that was not something that was allowed to be said. So then, then things, of course, changed pretty dramatically during that administration from December 2019 to January 2020. And so when we had the beginning of COVID and cases start to mount, and we were woefully unprepared, there was a lot of discussion about how COVID was used in a political sense instead of an infectious disease sense. The administration, Trump himself, immediately blamed China for the virus and suggested that it was a biological weapon. There, the short answer to all of that, just to let you know, even though there's always lots of churn in the media about where COVID came from, it is absolutely a natural event. And coming from a market in Wuhan, there's so much science behind that conclusion right now. Of course, it's natural if you consider it to be a natural thing to put a whole bunch of potentially sick and illegally captured animals together in a small space and treat them poorly and have bad conditions for safety. But that's a separate thing, but it definitely was a natural epidemic. So there were some big problems that were revealed, though, in health security when it comes to how the pandemic unfolded that lead us to think of how we should be thinking about priorities for the next couple of years. The mechanism that the U.S. government uses to be able to develop medical countermeasures, Operation Warp Speed that developed the vaccines was wildly successful. But the normal mechanism that the U.S. government had to develop diagnostic tests, to develop vaccines for other diseases, that was dismantled during the Trump administration, and it has never really been put properly back together again in this one. The mechanism to fill the strategic national stockpile, which is where we were hoping to get lots of stocks of PPE, so personal protective equipment, masks, ventilators, that sort of thing. The cupboard, when it was looked at during COVID, was quite bare. And the mechanism to fill it it's starting to be put back together again, but it's still not where it was before the administration. One of the original sins of COVID was our ability to do testing. So if you recall, there were months where people were like, I think I had COVID a few months ago. I had all the symptoms. I'm probably immune. And so then we were doing lots of testing to see if people had antibodies against the disease. So that's what the serological tests were that was referenced in my introduction. So there was months delay for us to get the rapid testing in place to see if you were actually sick and actually contagious at that moment. Whereas other countries, especially in Hong Kong and Taiwan, they had testing months available testing months before the US did. States were not well served by the federal government during the COVID pandemic. So it was really a kind of a state-by-state strategy where in Maryland, Governor Hogan was relying on his wife's connections in South Korea, because she's South Korean, to try and get supplies directly from their stockpiles. So that was pretty terrible. And then, of course, we know that because of people not having trust in the vaccines and having all kinds of theories about them, at least 200,000 people died that could have survived if they had gotten vaccinated, and 200,000 Americans, that is, many more people around the world, but people who basically died because of their political beliefs. And probably it could be a much higher death toll than that. So that's the experience that we have with health security, but how are we thinking in the time ahead, right? A lot of people today in public health I've talked to are having lots of panic attacks because of RFK Jr. was said to, he could be in charge of the Department of Health and Human Services, and he's an anti-vaxxer, and he recently was railing against fluoride in the water, which is actually, by the way, like one of the best public health interventions ever. I mean, not that dental care in the US is great, but like it could be a lot worse. And I grew up, and I'm personally infected by this because I grew up in an area of New Jersey that doesn't fluoridate its water because they were at one point convinced it was like a communist plot, and so they just didn't. And I have bad genes, and I was given tetracycline as a baby, so I've got like multiple risk factors. But like I totally blame the lack of fluoride in the water for like the thousands of dollars that have gone from me to dentists over the years. But anyway, so a lot of people are really concerned that you have this person who's basically anti-health in charge. I am less concerned about that because I think if we look at when Trump himself got COVID, he did not want some woo-woo crystal stuff to treat him. He got everything in the kitchen sink thrown at him from, all the latest antivirals, all the latest monoclonal antibodies. I think he himself knows the difference. And so I think what we will see, though, is some of the doctors like Scott Atlas, who was in charge before, people who have kind of, they have a medical background, but they're not scientists. And they use a lot of politics and wishful thinking in and how they approach things. And there are some famous ones that I'm particularly worried about. So the vision, I'm going to just now switch to a few challenges that we have to deal with in the next administration, and so we can talk about how they may approach it, but there are just some longstanding things that whoever is in charge would have to deal with. The first is national competitiveness. Biological manufacturing, biological research, the potential for biological products to boost economies, health data, medical countermeasures, all these things that are in the big area of biological products that people can make money off of, and biological data, health data. All of this is something that many nations are investing in. And so the US used to be the only game in town when it came to biotechnology. For many years, biotechnology was created basically in the US with the first flavor saver tomato that made people, concerned about GMOs, to the first vaccines, the creation of insulin. All these things were started in the U.S., but other nations have invested, and so it's not exclusively the country that people talk about, but it's hard to avoid the distinction of how much China has invested in biotechnology and how coordinated their funding has been and expansive, and how they have been intently going after using the private sector to go after data to be able to boost their standing in biotechnology. So because there isn't much of a distinction between the public side and the private side in China, there's a lot of things that China can do to buy companies that are in the US to be able to get the advanced technologies, and these are options that the U.S. does not do in other places. So this is a big distinction. So one of the things, there's a lot of concern right now in Congress about trying to make sure that we stop handing our research discoveries to China. But I'm a little concerned that as of late, the reaction has been more reactionary and not forward-thinking. And we need to think about a future where we are one of multiple nations investing in biotechnology, and we don't want all China to hold the supply chain for all the things that every nation needs. But we are not going to go back to a time when the US was the only game in town. So we have to think about how we're going to proceed. And part of that means that we need to get better. We need to invest in biotechnology more, and we need to run faster. And we have to accept sometimes that our assets might benefit other nations as well. And honestly, a lot of these things have a health component, so this is not a bad thing. But we need to think about like running faster and making the US a better place to do research. The second is challenge is pandemic preparedness. I know nobody wants to think about COVID, and I think COVID has a lot to do with where we are today, in this election, that people are just not quite done with the flux of that history. But we have I don't know if you've been following, but there's some H5N1 influenza spillovers from dairy cattle to humans. We don't know how pandemics are created, but if you're going to craft a scenario in which one could get created, that would be, a really very plausible way to start, because the virus will get better adapted to spreading and infecting humans and potentially spreading between them. So it could be that the next disease emergency is H5N1, but nature has a lot of surprises, and for a long time, when was it? It was 2008-ish. Everybody was really, really concerned about H5N1 coming out of East Asia, really, really worrisome trends, infections of birds. And then it seemed like out of nowhere, we had a different flu that came more from Mexico and started spreading and became a pandemic. So, you just don't know. All I can say is that it is certain that we will have future pandemics, and it might be in 4 years, it might be in 1 year, and no one can say. But we do know that climate change is likely to exacerbate the potential for a future pandemic, because when you have warmer climates, you have expanded territories for different mosquitoes that carry diseases. You have different animals that are more susceptible or can carry the viruses that are going to different places. You have if you have urbanization, people living too close to where bat populations are. So there's lots of human-driven events that could potentially make a pandemic happen faster. And of course, there's people travel all over. It's really hard to contain once things start spreading. The third thing is emerging technology and especially AI. I currently am sitting on a committee and from the National Academies of Science, Engineering, and Medicine on how AI will affect biological security risks. And I think, so I don't want to get ahead of the conclusions of the committee, but it's still really early days. And I think that, right now there's been a lot of public freak out about AI and how that will, doom us all. But it is, so I think there's the benefit equation is still, there's still a lot more benefits that we can draw to making drugs that we need using AI. But, it's just technology is always a little bit scary, and policymakers always get freaked out by the latest advances. So that's going to be an issue of flux for the next administration, whether it's AI or whatever comes after AI. A couple of years ago, it was the public freak out about CRISPR. But notice all these things are really revolutions, and both CRISPR and AI basically got Nobel Prizes in recent years. So, these are advances in science that are going to just keep on coming. And my fourth challenge, and I'm not saying that these are all the challenges, but these are the ones that just occurred to me, is the lack of expertise that's kind of prevalent across government and outside government and health security. And this has been a long-standing problem. This is not something that is new to this upcoming administration, but very often politicians or policymakers or national security people will be like, oh, it's a health problem. let the HHS people handle it, or let the health people handle this. But the problem is that health security issues permeate lots of other kinds of issues too, and national security is greatly affected by health. And we first saw this, the first time people made that connection was about HIV/AIDS, over like decades ago, where that was the first time that a pandemic was seen as a national security threat, and you could see that it could affect the stability of nations that were greatly had many patients. But COVID, you started to see lots of national security type people say, oh, you know what, maybe, pandemics should be considered more of a national security threat. Certainly, I think that's a kind of an obvious one. But my big story when I talk about the whole issue of why we need to have more public health and bioliteracy among national security people is the killing of Osama bin Laden. Now, the people who killed him were posed as vaccinators, and was that the only cover story that they could have chosen? Who knows? But I bet they didn't even consider another one. I would put some money on that. And the choice of that as a cover story basically meant that vaccinators in that region had a target on their back, and there had been many people killed. And of course, a lot of polio as a result. So that's kind of the, people need to know more about these health issues, even if that's not their day job. During the pandemic, it was the height of the pandemic. It was a very tumultuous time, but I still thanked my lucky stars that the company Theranos had gone away prior to the start of the pandemic. I don't know if people remember Theranos, but there was a great movie about it. There's a great book about it called Bad Blood. It was an amazing story of how this woman who is now, I think, in jail, and how these two people, they basically swindled everyone into believing that you could have this diagnostic test that would require just a drop of blood, and they got Walgreens to buy into it, and it was top level grift. And also for people who knew how to do diagnostic tests, they thought it was just totally magical thinking. Like, there was a lot of people who were raising doubts about it, but people just wanted to believe, and they kept investing in her and this company. So they would have certainly made a killing over testing and COVID, but for the fraud that was detected before the pandemic. I guess I didn't label this. I thought I had only 4 challenges, but I have another one that I didn't label in my notes. And that is that people have a tendency to balance risks and rewards of technology in different ways. And working through that is a big challenge, because all of these biological research areas have potential downsides. A lot of biology can be misused. You can make biological weapons. But on the other hand, you also can make things that are helpful for treating patients, preventing illness, or growing your economy. So it's that's true about anything, but it is definitely true about biology. So in the last couple of things I want to say, like, what do I think we need to be doing? And if I were in charge, which is just not going to happen. But what I would like to see happen is that we do need to update our regulatory processes. A lot of biology products that are they're really promising, that will be helpful, that will be make people a lot of money and grow our economy. They have a hard time fitting into the regulatory structure that we have, and so people are uncertain how it's going to go, and that makes it hard to actually bring products to market. So we need to basically update the way that what we call the coordinated framework handles these kinds of products. So the coordinated framework is the FDA, USDA, EPA, and I feel like there's a fourth one. It'll occur to me. But basically, like if you have like there are some weird things, like if a pizza doesn't have pepperoni on it, it would be the FDA versus the USDA's responsibility. But there's like lots of things that need to be settled to be able to have a clear regulatory framework. We need to think about how we have our immigration when it comes to talent for our science. We do a great job of training people and then kicking them out of the country. We ideally should find a way to have them start their companies here in the US. So, and we need to continue to boost public health because that's not, we're back to the days pre-COVID where there was no money in public health. And yet we have a big need, and we need to take spillover risks seriously. And I would love to see much more done about these H5N1 spillovers because, even though my opinion of people may not be that great at the moment, in the end, there's a lot of potential harm that could definitely come if we have another flu pandemic. And also, I'm also very concerned because it has really, it seems to be especially bad for cats. So this is something to be concerned about and there's been some terrible infections and lethal infections of cats that have gotten it so far. So those are some, I didn't use a full 45 minutes, but like there's lots of stuff, and I'm happy to talk about anything related to health security. I did a lot of media during COVID, so there's truly there's no question that you can ask me that I can't answer or at least give something about. Oh, thank you. Jackson?
So
Thank you, Dr.
Oh, happy to.
Thank you again for your talk. I have a quick question just about pandemic preparedness and then relationships with the World Health Org. I was in a talk this morning with a law professor, and we were discussing the topic. But how do you think with this upcoming administration, the relationships between the World Health Org and the US, how do you think that's going to be affected? I know we've already, America pulled out in 2020, but what do you think the future of that is going to be looking like?
Yeah, I think there are parts of the World Health Organization that work better than others, but it's really the organization itself. It's got lots of challenges because everybody belongs to it, and so the things that it can do are not necessarily speedy, and it does about as well as the nations that fund it allow it to do. So I don't know if that will be a priority to pull out of the World Health Organization again. But I think that's just it's kind of more eye-rolling to me in a lot of ways. I'm a little bit more concerned about us pulling out of NATO. I'm more concerned about us pulling out of removing ourselves from I was convinced we were going to pull out of the Biological Weapons Convention. And that I think I heard some people grumbling in that administration about how treaty compliance was keeping us from competing with China. And I don't think that's true. But if there is that perception that that it's a roadblock, I worry that will lead to us pulling out of the BWC. A lot of people say, well, the BWC doesn't do anything. And it's true, the BWC, like if you've gone to a few BWC meetings and then you took a couple year break and then you went to another BWC meeting, that you would find that it would be like quite familiar to you. But we don't have, in contrast to other kinds of weapons, we don't have nations publicly bragging that they have biological weapons. Has been successful in at least, establishing this norm that you are not supposed to have biological weapons. That is something that not all nations have adhered to, of course. Russia had an extensive biological weapons program, employing thousands of scientists once upon a time and probably to this day. And other nations, certainly there are other nations that are at least on the State Department list as having biological weapons programs, but nobody's bragging about it like they are about their nuclear programs. So I think there's something to be said for that. But so yes, I'm not, who knows what that will entail. I think that will be more of a problem for other nations because the US does provide a lot of the budget to the World Health Organization. But I think as far as international security, I'm more concerned about some of these other treaties.
I have a question. I am currently taking a course called Bioterrorism, and in this course, we kind of discussed how the threat of bioterrorism is great, or the fear of bioterrorism is greater than the actual threat, just because acts of bioterrorism can be so hard to actually bring to fruition in the way that, spreading agents or just making any kind of widespread result. Do you have any thoughts on that?
Sure. Yeah. I mean, there have been certainly cases where there's been bioterrorist acts, and even biowarfare. The Japanese used biological weapons against China during World War II. So that is not something that's commonly known, but it's a big feature in China, a lot of Chinese movies apparently. But anyway, yeah, there's only been a few big incidents. The Marithrax in 2001, the Om Shinrikyo in Tokyo in like 2005-ish. But we didn't know that they were developing biological weapons. It was because they used sarin in a Tokyo subway that the whole program was caught. Iraq had a biological weapons program, unbeknownst to us, that was discovered after the first Gulf War. So it is pretty, it's not something that is super, super common. I think if it was, then we would have more sophisticated tools to be able to deal with it. But so the fear is definitely there. I think people think it's easier than it is. One of a previous National Academy study I was part of that published in 2018, because there's always like this freak out when it comes to a new scientific paper and people are like, oh my goodness, this is going to really change how we, our biosecurity risks. We kind of broke it down into this framework, like put out all the steps, like how does it change your ability to create an idea for a biological weapon? How does it change your ability to actually produce it in the laboratory? How does it change your ability to deliver it? So like all the different steps, and it is more involved than, building something that can blow up. So I think that that's going to continue to be the case, that people are going to fear it and fear that, that it's that this one discovery changes everything. And then there'll be people like me and others who will keep saying like, no, it's really not that way, and we don't need to lock down science because we draw a lot of benefit from science, and yes, this might change our risks slightly, but it's not going to. It's more complicated than just all of a sudden AI, for example, is going to make it easy for anybody who has no prior experience to make a biological weapon. this is how I know that I've become a professor. I teach another some classes, because if you had asked me that question about 10 years ago, I would have given you a 2-sentence answer and that's it. But now I can like fill up the space, and talk about different things. I just realized my cat's sitting here.
Great, thank you. I appreciate it. Yeah, just anyone in the HAPI program have any questions, and we can go through those, and then we can open up the questions to the larger audience.
So it's been sort of it's been sort of horrible watching H5N1 sort of advance, like through different animals and possible human to human transmission, et cetera. And after COVID, I was thinking that we botched that so thoroughly that if we had a virus or another agent with a higher level of lethality, like we're just toast. But what are things that lessons learned from COVID that we should be applying to H5N1 or whatever the next epidemic is going to be, leaving aside the fact that the next administration may not do any of these things, but what should we be doing?
Well, just as something to kind of ease your mind about H5N1, most people have been exposed to H1N1. I think everybody over the age of 2 has been exposed to H1N1, and that having that exposure to the neuraminidase, the N in that sequence, will probably give people a little bit of protection. So that might be one of the reasons why the cases that we've seen have been mild. But mild is like, I'm always suspicious when doctors say something is mild, because I know that I've personally had things that didn't seem very mild to me, and yet the doctor's like, these are mild symptoms. Like, yeah, I don't know. I mean, like, you try having them. So these, it's kind of, that is what it is. But it is very disturbing, because back 10 years ago or so, H1 and H5N1 was only seen in these occasionally in birds, and then birds would have to be culled, and poultry would have to be culled to get rid of it, and you would have these devastating, very lethal infections, spillovers to people, and so since that time, it has acquired a number of mutations where it spreads quite easily between different mammals, but not between people as of yet. And there's been some pretty terrible die-offs of different kinds of creatures, including like seals and it's definitely run amok on mink farms and things like that. So I think this is so with lessons learned here, I think diagnostic testing is definitely one of the lessons that we have to learn. We have to get better at it. We thought we addressed it, and then if you recall, Mpox started spreading, and that overwhelmed our diagnostic testing capacity. We have the ability to test lots of people. There are only a couple companies that can do that sort of coast-to-coast testing, LabCorp, Quest, that can handle that sort of capacity. We need to get them involved in the planning and thinking about doing some test runs when it comes to testing earlier in the process, instead of what happened during COVID, which is when Mike Pence calling the CEOs of those companies and trying to get them involved after the disease is already spreading for months. So, we had proposed that there be a public-private partnership that's put into place pre-pandemic that plans for these things, does real test runs to try and produce a diagnostic test for an emerging disease, and be able to have that as a practiced relationship. That's the way Taiwan was able to be able to rapidly roll out testing months ahead of the US.
So I have a quick question. So Is there room for a global body or a global system? You know, I'm thinking even in the US, there was multiple parties trying to develop vaccines, including, you know, the work in Texas to develop a vaccine for more global use. And then the Chinese vaccines, Taiwan, etc. Is there a better way to do this, or is it better to have a lot of people trying?
Well, there's something to be said for having a lot of shots on goal, and that was why Operation Warp Speed was so successful, that there was a lot of money put into several different approaches. And if you had told me that the mRNA vaccine would be the one that would be the clear winner, I would not have believed you. But but that's the surprise, and the that's why science is so cool, right? You just like, that's why there's these unexpected results, and sometimes things can be wildly successful. Yes, there's certainly lots of better ways to approach this, that where people come together and think about how to plan for a pandemic, and that's the thinking behind CEPI, oh gosh, it's CEPI. The acronym will come to me as soon as we're done with the Zoom. But they are trying to develop vaccines in less than 100 days to be able to provide to the world. But that was not how things unfolded during COVID, and I don't think that's how nations are going to respond to something the next time. What happened during COVID was that the US and other nations did not share their vaccines with the world. And there was a lot of strife about that. You had some mostly authoritarian countries be able to share their vaccines with the world, because I mean it's just a feature of a democracy where people are not gonna, like, what do you mean you're sending our vaccine to this country first, before everybody is vaccinated here? It's just a lot easier if, like, there aren't that many people involved in the decisions. And so you saw Russia, for example, you sending their Sputnik vaccine to places and doing some vaccine diplomacy with it. I was a little surprised, but I guess people can have thoughts on this, that India also did the same before their population was fully vaccinated, or that they even made an attempt to do this. But so I think the lesson that a lot of countries that did not have their own vaccine capacity, the lesson they took from this was that we got to have our own vaccine capacity. And if we don't have it, if we don't have the capacity to do it ourselves, we're not going to get it. And so I think that there's been a lot of people who are complaining about how, well, a lot of laboratories are being built, trying to, high containment laboratories. I mean, I'm more sanguine about those risks than others, but that's the situation we left the world in, where people are like, you're not going to help the global South, so the global South is going to help themselves. And so that's it's just what it is. When it comes to labs, people get really I think that it's a good thing that people are building labs that can protect the people who are working with them. You don't need to have a lab that has all the engineered controls to be able to work in that environment. You can, if you were so inclined, work with Ebola virus in your kitchen. It's just a terrible, I mean, it's illegal in the US, but it's a terrible idea from the standpoint of the person actually doing the work. And there are a lot of places in the world where the safety of the people doing the work is not held in as high a regard as it should.
Okay, one quick announcement that next week we're going to have Professor Sam Halabi talking about monkeypox and possibly about vaccines for that. So I invite everybody back. Francis?
Thanks so much.
Yeah,
Gigi.
thank you so much. Thank you so much, Dr. Gronvall. It was a pleasure to hear from you. You've definitely given us so much to think about as we trudge forward. I really appreciate it. Thank you for meeting with us today.
Thank you. And thank you for having me. And well, one thing that you can always count on is that, nothing lasts forever. So whatever happens, there will be a tomorrow.
Thank you for that little bit of encouragement. So on behalf of Adrian and Francis and I, thanks again, and we'll see everybody next time.